We are super blessed and lucky tonight because we have not one, not two, but three experts with us. So I want to tell you briefly about each one. They have each have just phenomenal resumes and biographies that we could tell you all about. But just to keep it short, I'm going to tell you we've got Dr. Gary Kleiner, who is the Associate Professor of Pediatrics at the University of Miami Miller School of Medicine, and also the director of the Pediatric Allergy and Clinical Immunology. So he has a wealth of brilliancy that he's going to share with us tonight. Spent some time in New York at Duke, and then he joined University of Miami in Jackson in 2001. So he is the director of the Jeffrey Modell Diagnostic and Immunology Research Center at the University of Miami. He's also the director of the University of Miami Food Allergy Food Allergy Center for Excellence. And he's the director of the NIH Primary Immune Deficiency Transplant Consortium Center. So he serves as the immunology expert for the state of Florida Department of Health Newborn Screening Advisory Council. So any of those of you who have little ones, I know you're going to feel just in great hands tonight. He's going to have so much great information to share with us. So throughout the pandemic, he and his team performed pivotal research, and they received actually national press in COVID prevention and treatment in the NIH vaccine trials at the University of Miami. So exciting to say too that his team is embarking on a novel food allergy therapeutic trial that hopes to help patients with multiple food allergies. I'm like so fascinated by that. My husband has multiple food allergies, so I'd be interested to hear more about that. But Dr. Kleiner, thank you for joining us tonight.
Thank you. It's a pleasure to be here.
Yeah, we're so excited to have you. I'm going to introduce you to our next guest, Jennifer Gebbia. She joined the Department of Pediatric Allergy and Immunology in 2016, and she's a board-certified pediatric nurse practitioner with over 10 years of experience in pediatric nursing. So she received her undergraduate degree, from NYU and her graduate degree from the University of Pennsylvania. And she began her nursing career in the neonatal ICU and the pediatric ICU at Mount Sinai in New York. And then she later worked as a pediatric nurse practitioner at Children's Hospital of Philadelphia, also in Los Angeles, also in West Palm Beach. So she works closely with all the members of the allergy and immunology team and all the subspecialists, and she's involved in clinical research and trials. So thankful for her vast experience in allergy and immunology, she's come to understand the struggles that families really deal with when they face these allergic diseases. And she's particularly interested in working to find ways to improve quality of life for children and their families, which I think is awesome. I think that's why we're here tonight, is how can we improve the quality of life for those that we love that just struggle every day with these food allergies. So in 2019, she was recognized as the Pediatric Nurse Practitioner of the Year. And in 2020, she was recognized as Nurse Practitioner of the Month at Holtz Children's. So congratulations on that. Jennifer, we're so happy to have you.
Thank you. I'm excited to be here. Thank you.
We are super excited. We're glad that we got you from the north down to South Florida. So
yes,
thankful for
definitely
that.
enjoy the winter.
That's right. The winter. The winter in Florida is the best, right? And then Laura Delfina, we are so happy to have you. She's a registered nurse and has been for more than 30 years. She received her degree in nursing at Wagner College, and she's worked in post-operative cardiac care. Wow, I can't even imagine that. And intraoperative nursing while at New York University Medical Center. She also has experience as a school nurse to more than 7,000 students. That's amazing. In a school district in New York. And her passion for children and teaching is what led her to the University of Miami Pediatric Allergy and Immunology team. So welcome. We're so happy you're here, Laura.
Thank you. Thank you so much for having me.
Well, let it be known that we really have a wealth of information right here at our fingertips, which gets me so excited. And I already have my own personal questions brewing. So again, audience, if you have any at any time, just drop those in the Q&A and I'll get them in front of our experts. But just to get started, we're talking about the holidays. And of course, we can't talk about the holidays without talking about food. So what are some common allergies that really are present in holiday food? And then are there some that may not be as common, but are still a potential danger that we should be aware of?
Yeah. And, first, just thank you all for being here tonight. We're really excited to do a food allergy talk right around the holidays because, unfortunately, most of us do assimilate, holidays and traditions with food and, surrounded by food. So for families with food allergies, it's definitely a difficult time of the year, just in terms of, trying to find ways to keep your child safe. So thank you again, for having us. And on that, I think, just to start out with food allergies in general, right? We know the top 9 allergens, which would be milk, egg, wheat, soy, peanut, tree nut, fish, shellfish, sesame now, which, has been labeled as an allergen as well. We know that when you're talking about preparing food and eating food, right, we have to kind of go back to the basics. And one of the things that we always stress with families, especially even before you get to the event, is in terms of reading labels, right? So especially when it comes to holiday food items, which can often, change or have these like hidden ingredients, the most important first step is reading label. So it's every label, every time is, extremely important to be stressed. Other things in terms of actually being at an event or in terms of like thinking about the food that you're going to be eating, some kind of practical things I always like to think about, kind of like when you're cooking, right?
Right.
So what is the food cooked in? Number one, how is it prepared? And then also, asking for recipes, right? So when we're thinking about foods, for example, okay, Thanksgiving's coming up, you have turkey, I have one like right behind me. I don't know if people can see some decorations, but you would think overall relative. Yeah, I know. Turkey overall should be something that should be essentially allergy free, right? It's just the turkey. So some things that we don't think about, going back to, okay, what is the food cooked in, right? So is it a self-basting turkey? Some ingredients that you might find in that, there may be milk that's hidden in this self-basting, turkey product. Other things in terms of like a broth, like the bouillon cubes, right, may contain soy or different seasonings and spices. Most of the time, spices we have to be concerned about hidden allergens or cross-contamination with sesame or mustard or other seed allergies. Other things like gravy, just in terms of how it's prepared, right, that may include wheat or soy or milk products. And then when you go to how it's prepared, so for example, going back to the turkey, okay, is it deep fried? And then we're thinking about, okay, how is the turkey deep fried? So usually if it's a peanut oil that has a high, smoke point, typically it can be safe for children with food allergies. However, if you're going to, family members and you're not 100% sure, like if you're going to go for the deep fried turkey, do you feel safe and comfortable thinking, okay, I feel okay to give this to my child, or I would rather choose something else. Other items that you might see on the table, say, for example, like spreads or appetizers, even if they're listed as vegan, right? Most of the time, the main component may be a soy base or a tree nut base, like a cashew based. Seeds are another big one that can be hidden in those allergens as well, too. When we think about like stuffings and casserole dishes, right? So casserole might have, the vegetable. There may be hidden things like eggs to use as a binder. There may be milk products that may be in there as well, too. Even if you're doing a stuffing with sausage, say, for example, we're Italian, typically we like to, find ways to include all of these good Italian there, but so the sausage itself, not only just the spices, also like the casing, which may have some milk in there. So it goes down to like very specific details that we have to be looking at when we're examining each dish. Trying to think of it, rolls, for example, or like baked goods. Is there an egg wash on top? Is there a baked milk or a baked egg inside the same product? Or same idea, is there a frosting that may have like an egg white in the frosting? Is there cross-contamination between the bakery, especially with tree nuts or with peanuts? And then also, we always have to think about like how the item is prepared in terms of cross-contamination within your own kitchen, right? If you're making another dish at the same time, is there a risk of cross-contamination? Or, if you're putting an item on the counter, have you wiped down the surface appropriately to make sure that there's not that cross-contamination?
Wow.
So, other things I think in terms of just dishes that may come to the party or to your event, for the parent itself, being the advocate is most important, right? And asking families for recipes. So, either, if it's a family recipe, no secret recipes here in this
Yeah.
type of situation, right?
Come on,
No,
Grandma, Abuela's got to tell us
secret
what's in that,
family, we have to be pretty detail oriented. And then if it's, food that's brought to the event, even we could talk about this later too, but also, asking family members or other members, take a picture of the label if this is a packaged food before they, pull off the covering, or, keep it in its original package in mind so that you can then examine the food in more detail.
Yeah. Wow. As like personally, I thankfully don't have any allergies, nor do my children, thankfully. But just hearing you talk through that process, I just feel like the weight for caregivers, for mothers, for fathers who are having to like all day long, all the time, thinking through all of that and all that preparation of making sure that they or their child, their family stay safe just at a meal like on any given day. And so it's just such a reality check and a reminder that this is stuff that people face every single day. And while it may not relate directly to us, especially at the holidays when we gather, just how important it is to take into consideration those that this does affect every day, our families who are struggling or have, allergy issues. And so on that note, how do we encourage us of how we can talk to families about things like this? Because again, maybe some people have never had the thought, they just eat what they eat and they prepare what they prepare.
Mhm.
But how can we have talk to our families about food allergies prior to the Thanksgiving celebrations? And you mentioned that about taking pictures of the labels and that kind of thing, but anything you would add?
Yeah, no, I mean, I think it's a great question. It's something also as like a reminder too, right? As a parent,
Mhm.
your ultimate goal, right, is to keep your child safe, right? If we're talking about children with food allergies, your goal is to, protect them, to keep them safe. And, from the standpoint with food, right, managing food allergies, it's an element, making sure every single thing as best you can, right? Nothing is 100% foolproof, right? We know accidental exposures are going to happen, but at the same time, like, as a parent, in terms of trying to manage this, right, you're trying to say, okay, I'm going to do the best that I can to make sure that everything my child puts in their mouth is safe. And when you're, in your bubble, in terms of, you're in your house and you have your routine with the standard lunches, you kind of get into a specific, more safe environment. However, when you go to these, gatherings, or if you're a new environment, there's a lot of, emotions, right? Psychological different elements that come into play. It's stress, there's anxiety, and trying to recognize that to create a better experience overall, like for the family, and so that people can enjoy the holiday, right? The whole goal of the holiday is to enjoy, your family, enjoy your loved ones, and to enjoy the time together.
Yeah.
So I think just going back to like some basic principles in terms of like, number one, always being right, an advocate for your child, and saying, okay, I may have a great understanding of food allergies, but recognizing that it's a great time of the year to kind of re-educate other
right.
people. I mean, number one, you may not have seen the family members for a long period of time. They may forget, right,
Yeah.
what the food allergy is. People have a very different understanding of what an actual food allergy is versus, say, for example, an intolerance, or if it's, they might think themselves, oh, sometimes I eat that, oh, it kind of hurts, right? So re-educating them, and then also, the other thing is too, it may be a year, so your child may have different food allergies at this point. They may have outgrown some food allergies, they may have new food allergies. So just going back to the element of like really re-educating in terms of what is important for your child to be avoiding. Definitely making sure that you use language, I guess, that you want to say, right, that really tries to legitimize the food allergy, right? So some people using the word anaphylaxis is like a really different abstract of thought. So using words like severe, life-threatening, or cross-contact matters, or every bite matters, or one bite matters, right? Using very clear, concise words, I think, is very helpful, and being very direct. If you do not want anyone else, right, to be giving your child, or to be providing food to your child, be direct about it. Too, like it's important time, depending on their age and their understanding, just reinforcing that to them. Okay, hey, we're going to, so-and-so's house, whatever. Okay, this is what you can eat, or, really telling them, okay, if someone is going to give you something, come to me first, or come to a point person. Maybe it's the aunt, maybe it's the grandperson. Just having one person there, and other people knowing that they can't just give them a spoon of, this ice cream or a spoon of this dessert. No, it's,
It's serious. Yeah. That's
um,
good.
it's
Anything you would
exactly.
add just about when you first maybe arrive, like with the, great what you're saying, and added just like what a parent should do maybe when they first arrive at a gathering. Like, are there things they should do to, like, check the area or survey the zones kind of thing?
Yeah, I think, anytime, right, you're going out with a food allergy, parents are really used to reading labels, say for example, right? But when you're in a new environment, right, this, whether it's a house or it's an event at a park, right? So
Mhm.
always kind of going with a plan in place. It does take planning, but it can be done, right? So you can have a great time, it can be safe. I think most importantly is planning ahead. So some things that I think can be helpful are just, number one, like we said, reminding other people not to provide your child, obviously, with something that does have the allergen, but then also with like the hidden allergens, making sure that the food is always checked with you first.
Yes, yeah.
Reviewing again the importance of cross contamination. So say you
Mhm.
arrive at, a dinner party, or it's going to have,
Mhm.
whatever, lunch, right? So explaining to the host, cross contamination is important. So we need to use separate utensils, making sure that the area, is wiped down before the food is placed out on a buffet.
Yeah.
Also, just even going back to kind of the preparation aspect, talk to the host ahead of time and see, like, what are they going to have? Is everyone bringing something different? Is one person preparing food? Are they ordering food from
Mhm.
someplace? So then you
Yeah.
can kind of be mindful of getting an idea of maybe what, your child, maybe you do, or you just decide, what,
I'm just gonna bring something
for me, my
complimentary.
comfort
Yeah.
level, which typically, exactly, which we typically, end up recommending, is make something with your child that they enjoy, right?
Yeah.
Making whatever their favorite food is and bring extra. So
Yeah.
if you do bring something to event, either take a portion of it out and set it aside so you can ensure that it's safe.
It's not cross
Um,
contaminated. That's good. That's good.
exactly. So it's not cross contaminated, and like bring extra. So if people do enjoy it, there's enough to share so everyone feels included.
That's good. That's
Um, I think other things would be, like we talked about, if someone brings a packaged item, or if they're going to be bringing food in from someplace else, taking a picture of the label or keeping it in the original packaging so you could always
Mhm.
check it. Um, Other things to consider would be, if it's a buffet, say for example, if someone has an allergy, maybe asking them to pass first through the buffet so there's
Mhm.
less chance of cross contamination. Don't, show up very hungry if you can, try to, so it prevents like some of the nibbling, or like going to things without them, taking the time to really make sure that they're safe for an item. And then, just bringing enough snacks, say for example,
Mhm.
you are going to be at a place where you think, okay, it may get extended, you may be there later, you may get hungry, bring enough safe foods. And
Excellent.
then anytime, right, we're at an event, even if you are going to be at, even grandmother's house, right,
Mhm.
always the most important is making sure that you're prepared in terms of bringing your auto injectors, making
That's
sure that you have your medications in place, you know when to use them and you know how to use them.
that's good.
And then
That's good. I have more
also,
questions about that too. Oh, I didn't mean to interrupt you.
no, no, no. And just to defend it, just in terms of, and just making sure, I think the other, important element is, when you're in a new environment or in a house or a different situation, making sure that your child knows, say, for example, if they don't feel well, if something doesn't feel great, like who are they going to go to at this event or at this party to be able to tell someone that they're not feeling well, right? Make sure
Yeah.
that there is
Who's
that
that
point
one person?
person.
That's great.
If you're not going to be there, if it's, father, grandmother, aunt, uncle, whoever it is, they
Mhm.
need to know they have a safe person to go to if something comes up.
That's great. Oh, that's great. Good info. I want to draw Laura in on this as well. Having worked with, thousands of children in the school system, I'm sure you have some tips and tricks for this too. But what are some ways that we can make, our food allergic or celiac children feel a part of the celebration, whether they're at a relative's house or at their school? All the little Thanksgiving parties are happening right now, and then it'll be the Christmas parties. Like, how can we help make these children feel included?
Sure, sure. So, school settings are very different than home parties or celebrations or
Right.
holidays, because most of the time parents aren't around, and that's the child's number one defense against getting a reaction. So it's very, very important. I kind of like to divide things. It's in prevention and then actually preparedness. So for prevention, like Jennifer had mentioned, avoiding. The child should know which allergens they must avoid. Communication with the people at school or at any event. It's very important that the parents communicate to teachers, coaches, anyone who's caring for their child in school should know what that child is allergic to. There should be a care plan, an emergency care plan, in case that child does come in contact with the allergen and with accidental ingestion. We need to know, how are we going to treat that child in school? So there's a lot of teaching involved. So teachers need to work with parents. Parents need to articulate if it's a newly diagnosed or at the beginning of a school year. This is when care plans are specific for each child. And then anyone caring for that child will then know what to avoid. And if there is a reaction, how to manage the reaction. It's very important, I think, parents to start at home, teaching the child what foods to avoid. So when there's not a parent around, they have some idea as well. So once again, like Jennifer mentioned, depends upon the age bracket. Smaller children don't have a concept such as older children or teenagers. They're less aware. So there has to be very good guidance and teacher-specific guidelines. Another thing for teachers to do is, if there are known allergens in the classroom, maybe have that parent who has the child with the allergen participate in the celebration. This way, there's a little comfort level for the parent and for the child. Maybe have that parent bring the non-allergy food that the child can eat, but can share, like Jennifer had mentioned, to a celebration, bringing something from home. So this way the child feels included. They're bringing items from home. They're able to eat it. Other students are able to eat it, and not having that stigma of, oh, they're different than me. So that's a real big thing with children. Keeping those allergens away from, maybe on a separate table, having separate stations set up so there's a decreased chance of cross-contamination. Encouraging hand washing, teachers, especially with the age of COVID, very important. Before we eat anything, let's wash our hands. After we eat, let's wash our hands. Or, preventing the cross-contamination of utensils for items. Of course, label reading, like Jennifer mentioned, but there are some items that are not labeled, and therefore, parents should try to tell their child, children want to share. Children love to share things with other children. Unfortunately,
especially at the lunch table,
oh,
Yeah.
what do you
I
have?
had numerous times. Oh, but Johnny brought in something and I just tried a little piece of it.
Yeah.
So we have to try to reinforce with our children, it's kind, it's nice, it's generous of someone to offer, but don't eat anything that you are ever unsure of. If you can't read that label, it's not worth the risk of that. So that was a big thing, the cafeteria. So talking about school, not only the teachers, coaches, you have the cafeteria staff, you have daycare. So we're not only necessarily school, but we have daycare of especially our children that have no voice. So, we need to have a specific emergency care plan. So having those things, avoidance of things, but the real thing is, as much as we can say we are going to avoid and prepare, there is a chance that something may happen. And we all need to be prepared and ready to act upon the reaction. So it's key, no matter where that child is, there should be, if it's their EpiPen, that is the recommended treatment for their reaction, that EpiPen should be with that child always. So daycare should have it. The coach, of after school practices, they should have it. The teacher in the classroom. Sometimes they have nurses in school. So the nurses, everyone needs to know, where is that child's EpiPen, so that in case there is an event, we know we have it and we're prepared to use it. So that's another thing that I always instructed. The first day of school, when we had teacher conference, everyone was trained on how to use an EpiPen. So we had demonstration. So no matter where you are in school, everyone knew how to use an EpiPen in case of a reaction with our children. So that's really, really very important, that you have, your medication, obviously, especially in school where most accidental allergies reactions occur, a large percent.
Yeah, that's
And then
great.
one other thing, if I can just add,
Please.
try to have teachers also not use food as a positive reinforcement or as incentives. So I always try to have staff provide other items, erasers, pencils, maybe no homework, no homework pass, using non-food items as incentives. So it decreases the risk of any kind of reaction, in classrooms and such.
I love that. Even the mamas of kids with no allergies would love to see that for a number of reasons. That's a great tip.
Yeah.
We're talking about EpiPen. So, Jennifer, I want to jump back to you, and talk to us a little bit about, I mean, at the holidays, it's a given that some people are going to travel. Some people are going to travel, have air travel. So what do you suggest for families with food allergic children during air travel? And then how do you, can you carry an EpiPen on the airplane? Like, how does that work?
Yeah, no, that's a great question. So traveling, of course, right, can be tricky, but it's definitely doable, both, domestic as well as international travel. Again, it goes down to, being prepared ahead of time. So when you're talking about with the EpiPens or the auto injectors in general, so typically we always recommend families to bring the auto injector in its original package with the prescription label on there. There are specific, forms that say, for example, if you are traveling internationally, there is an international alliance for food allergy that does have some additional, what's actually the International Food Allergy and Anaphylaxis Alliance, actually, that has specific forms depending on which country you're going to, which can also be helpful. But I think just going back to the EpiPen, keeping or the auto injector, keeping the auto injector in the original package with the prescription, making sure that it's, not expired, it's up to date. You have refills, you have your antihistamines with you as well. And then also the same thing about in terms of, reviewing the usage in terms of when you would use it, how you would use it ahead of time to be prepared is really extremely important. We're talking about air travel in general.
Yeah.
Definitely, I would say communication is extremely important in terms of how so say, for example, if your child is traveling alone or you have a teenager that's traveling, right? So ensuring that the airline or the flight attendant or someone else is going to be aware of the food allergy, I think is important also. And then if it is, say, for example, like a teen traveling or someone else traveling by themselves, or they're in, a group, but they're solo, ensuring that someone else, especially like when you're flying or you're traveling in general, making sure that they have an understanding of the food allergy, what the symptoms may look like, where the person carries their auto injector, and then also how to use it. In terms of actually being on the plane and traveling, definitely beyond wiping everything down, like Laura was saying too, Lysol wipes, wet wipes, absolutely, both from the virus standpoint, but then also from the food allergy, to prevent cross-contamination, absolutely. Bringing your own food. Safest way to travel is definitely to bring your own food, checking with airlines ahead of time. There definitely can be cross-contamination. They may run out of a food item. And so there's no guarantee that you'll have something if you do want to have something on the plane. Making sure there's enough snacks, making sure that you have enough food, not only even for the flight, but there's delays, there may be a canceled connection. You always have to think about, like the extra foods. There may not be something safe to eat in the airport, or, it may be closed by the time, you arrive at your destination because there is a delay. So ensuring that you do have enough food available and like snacks, I think it is really important as well too.
That's great. What about international travel? And I'm like, okay, read the labels. But I'm like, I'm in Paris and I can't read the labels. What do you suggest for those traveling, maybe in a foreign country where it's hard to read the labels?
Yeah, no, that's a great question. I mean, just like we said, international travel, just like domestic, absolutely can be done, right? So just because you have a food allergy, you should not be limiting in terms of, where you're traveling or what you want to experience, right? It absolutely can be done. So I think from the standpoint of international travel, one thing to always consider is bringing safe, non-perishable items with you, but then also making sure that you're checking ahead of time about what is allowed to be brought into the country with customs as well, to make sure that they will accept the food when you come in. And same thing, bringing enough safe snacks and food available, not only for like the flight, the airport time, and then also like when you arrive as well. When you are traveling internationally, you do have to consider that stuff or foods that you may think are safe here in the United States may not be safe there. So there may be different manufacturing, there may be different ingredients, there may be different equipment lines, right, that foods are processed onto. So checking again with the labeling, and also clarifying as well what foods are mandated to be on a label in each country that you're trying. So for example, right, in the United States, we have the top 9 allergens. Other countries do not have those same regulations. So finding out ahead of time, especially if you're going to be in a place where you're going to go to the grocery store, or you're going to be, getting packaged foods, those kinds of things, you would want to look into that ahead of time. I did mention that they do have the International Food Allergy and Anaphylaxis Alliance, which does have not only information about like tip sheets per country. I did find that they are kind of helpful because it does list for you, how you would call 911 if you are traveling abroad. Wanting to locate like an emergency, right? It might be 311 or maybe, whatever phone number that's available. And then when you are thinking about reading a label or being able to communicate with a restaurant worker or a hotel staff, or if you're staying in Airbnb or location where there's someone that's going to be cooking for you, right? How can you communicate with them? So there's different 2 really great options for travelers. One of them is called Equal Eats, which actually makes these little wallet-sized cards that are available in 50 languages. I think it's about 50 languages or so. And it explains what your allergy is in the language that you're traveling in. So, and it's really great. It not you're lactose free. They have something if you're vegan. So there's a variety of options that are available depending on what your dietary needs are. You can order. It's really helpful. I mean, you can order them online. You can print, download and print it. You can purchase them already laminated. Another option as well that's helpful is the chef cards, which are available through Fare. They're available in 10 languages. So if you're traveling someplace where maybe it's not like Spanish or French or Italian, you have to get something a bit more specific, I would tend more toward the Equal Eats, but the food allergy chef cards are also wonderful. And the same thing, you can print them in the language you're traveling to, and it does give a great detail about, say for example, if you have a sesame allergy, right? Okay, so sesame could be tahini, it could be hummus, giving other target words that maybe, for example, the restaurant server may be more familiar with, rather than just saying, oh, I have a sesame allergy, right? Because people are thinking, oh, that's, not something as common.
That's good. Great.
I think, and then there's also, other ways in terms of like, if you are going to be grocery or if you're going to be looking for restaurants, if you're traveling abroad, there's different sites that we can also utilize, like Allergy Eats or Another great site would be Spoken, which is an app that helps you to look up restaurants and food brands, and both of those do work internationally as well.
Cool. I know I was thinking there's got to be an app for this.
Yeah,
there's an app for
exactly. I know,
everything.
right? There's always an app
Like there's
for
got
it.
to be an app. That's awesome. I'm old school and I would want the printed cards. I would want the
Yeah,
laminated
they're
printed
great.
cards.
They're laminated, they're wallet size, it fits right
That's
where
so
your
cool.
license is. So it's really easy to travel with.
That's awesome. Awesome. Jennifer, thank you.
Yeah.
Dr. Kleiner, okay, I want to hear from you. And I feel like I'm playing devil's advocate because I'm like giving all the hypothetical situations, well, what if you're traveling? Well, what if you're traveling on an airplane? Well, what if my question for you is, well, what if you're renting a condo or an apartment? What should you do after checking in case, items have, could be cross-contaminated?
So I guess it's so much, just adding on to what Jennifer and Laura said, a lot of it is just preparation and thinking, as a parent or, a guardian of a child or another, spouse or whoever, just to kind of think of all the opportunities where things could happen. It's best to prepare in advance so that if you're staying at, let's say a corporate chain, a Marriott rental or a Hilton rental, you can ask for a deep cleaning before. That's helpful, especially if you have toddlers, because you may find, a peanut in the carpet or in the sofa or something like that. So I think that's helpful, particularly on the cruises. If you're going, I mean, not really obviously a condo rental, but on a cruise lines, to notify them in advance that, your child or your family member has a severe food allergy. Um, um, Having said that, when you get there, it's very important to immediately, having a food allergy in our family, check the refrigerator as soon as you arrive. Make sure in the cabinets there's nothing left that is an allergen. If you find something, or before your child finds it, before you do. And then definitely, if you're staying at a condo or rental, put the dishes through the dishwasher or clean them, wipe the countertops down. And then there are several apps. It's good to check the local food markets, in the city that you're going to, where you can find Allergy Eats or Spoken. Some of the other websites are very helpful, or apps finding food allergy places, friendly places where you're staying, and then obviously finding the nearest emergency room where you're staying.
That's good. Oh, that's good. Yeah, that's something you don't think about until you need it, and then you're like, "Where do I go?" That's a great tip.
The other thing is helpful that people may not realize is, if you're going to purchase travel insurance, for any trip, it's very important that you buy a pre-existing condition clause,
Oh,
because
interesting.
food allergies, having this in our family, food allergy is a pre-existing condition, and there are different
Okay.
look back periods, so that, if your child happened to be in the ER last week, and let's say you're going to, New York or something next week. I mean, the domestic travel isn't so much of an issue, but some people have very tight networks where ER may not be covered.
Yeah.
If you choose to buy a insurance plan, make sure that it covers pre-existing. You'll have to pay extra. There are multiple websites, when you shop for policies, picking the plan that, a cruise line or a travel supplier supplies, sells you, may not necessarily be the best one. So we always recommend looking at, a comparison like website like Insure My Trip or one of them, where you can actually click pre-existing condition when you get a quote for your policy.
Interesting. Wow, that's a great tip. Yeah, I had no idea. And I love that you spoke about, cruises, because that's another means of travel, but also like excursions. And I would think this is good. I'm already thinking in my mind, like, okay, like pack ahead and like work ahead and communicate, and anything you would add in terms of just, family excursions.
So the excursions, I would be quite careful on. The cruise lines in general, and Disney, and any of the main cruise lines do an amazing job for patients that have food allergy. We've been on Disney before, and they've made nut-free snacks for my kids without, they kind of observe, so don't be afraid to say, in advance that you're going to, with special arrangements. The excursions, I would be careful, because the excursions are, and bring your own food if you can. The excursions are usually third-party vendors. They are aware of some. The other thing that's important as a parent is you don't want to create fear in your child, or create it, a vacation is supposed to be relaxing. So, it is scary, and traveling in a foreign country or in a remote area. But try and prepare as best as you can. Have your EpiPen with it, and don't. It's very important not to let it take over, because kids do pick up on the parents' anxiety, and it'll interfere with their fun too. But for an excursion, let's say if it's a cruise or a short day trip, I would definitely bring food with you. Don't rely on a food, like say there's a barbecue at an island resort or something. If it's a large resort that's owned by a cruise company, they're pretty savvy in terms of food allergic, food safe things. But a smaller excursion that you're purchasing from the cruise, I would be very careful.
That's good. That's great. Awesome. Great tips there. I want to ask a little bit about this. I had some friends who did this, with their children who had peanut allergies, but will you talk to us a little bit about what OIT therapy is, or that oral desensitization, and then how can you continue that when traveling?
So that's a good question. So it's growing, in popularity and knowledge. Basically, we know that we get sensitized to foods through our skin, and we get desensitized through our, for eating. So most of the ways to desensitize work by giving small concentrations of the allergenic food over time. Usually it's about 6 months or so of what's called a buildup phase. And then a patient will stay on maintenance, which means that you eat the food usually several times a week. There is no cure for a food allergy. There are several disadvantages of OIT. For instance, you can't or shouldn't play sports or take a hot shower or bath a couple hours after you give the food. There's a risk of anaphylaxis, especially at the higher doses. But if someone's sick, let's say they get stomach virus or throwing up, they have diarrhea, the dose of OIT has to we wouldn't necessarily increase the dose, and then we actually may hold the dose of the child. And also, if you're going, let's say, snorkeling or scuba diving or something like that, if you're on a Caribbean cruise, let's say, you wouldn't want to give the OIT and then do that. So you kind of have to think about what you're doing during a trip and work around it.
Right.
There are several trials now going on, both at the university. We're doing actually a trial desensitizing or trying to desensitize with basically it's like a Band-Aid that goes on the child's back in
Wow.
toddlers, and that may, from some data that was published in the New England Journal a few weeks ago, that actually may be safer than doing oral food desensitization.
Wow.
But in general, the OIT is giving small amounts of food, building up to what's called the maintenance and holding it. It does not, most of the time, it doesn't allow you to eat the food freely. You still have to avoid or be careful, but it does make the chance, if you were to have an accidental ingestion, your chance of having a serious reaction theoretically would be less.
Like less severe. Wow. I don't want to get us off, but now you've got my wheels going. And when you said, it's through, did you say through the skin that we're sensitized, and then through the mouth that we're desensitized? Did you say something like that?
Yeah.
Can you
So
explain how does that work?
most kids actually, their first reaction of anaphylaxis is before they've had the food. So for
Right.
peanut, for instance, 40% of the time, it's usually the report is the child's never had the food or the parents don't remember giving the food. From the LEAP study in Europe, in England, that was the impetus to do early peanut introduction in infants now. We know that kids with eczema are that's a very high risk factor for them to develop food allergies, particularly if you have a family history. So, controlling the eczema seems to prevent, I'm not saying prevent allergy, but will decrease the chances. There's some pretty good data out there now that that's actually quite important. And then obviously early introduction of the highly allergic foods is quite important. And then the desensitization becomes more problematic because at some point, it becomes harder to do that. We want to get the highly allergic foods in as a young infant to try and prevent the child from developing allergy in the first place.
Yeah. Wow. That's fascinating. It's so cool, the research and all that you have learned about it. Okay, I want to switch gears a little bit. Laura, I want to ask you, let's talk about how could we allow, say, our allergic teenager to feel like they have more autonomy during travel? Because obviously with the little ones, we're having to really stay on top of them. But with a teen, how do we help them feel a little more autonomous?
Sure. So obviously you need to know your audience. So, everyone matures at a different level. You have teenagers, they can be reckless at times. So it's very important that they are aware of their allergy and the what is necessary for them to avoid, what the allergen is, and that they should avoid it. You should stress upon them and the importance of reading labels and not sharing. And there's only so much a parent can say to a teenager at some time. But I think most importantly, you should teach your teenage or how to give themselves an EpiPen. So if they're going to have a reaction, so, teenagers take risks. We all know, everyone's been a teenager, and they all have that frontal cortex that's underdeveloped. They're going to try things. So if you explain to them the importance of avoiding items, but if there is an accidental, they should be instructed on how to administer the EpiPen. And it is something that is very simple. I've actually taught a lot of my students in school, and I've actually had one of them use it on himself for a reaction, which I have to say, his personality was not the one that I thought would do it.
Wow.
But he actually stepped up to the plate and hit a home run.
So that's great.
Yeah, so I have hope for teenagers. I do. So I think it's just very, very important, making them become familiar with the EpiPen. Jennifer had mentioned the FARE. FARE is FARE. It's a website that was devised by parents of children with severe food allergies. And there's tons of information for parents on that website. It's something that we recommend to all of our patients. It has for foods, manufacturers, recipes. It has YouTube videos, how to give an EpiPen. So basically, it's like a very informative site for parents who are in the same situation as you are. So there's lots of information there that's helpful. So I think for teenagers, like I said, they're going to take that risk. They might be, as long as they know what to avoid. But if they don't and they have a reaction, recognizing what the reaction is, what is an anaphylactic reaction, being able to recognize that sign, and then obviously being able to give them a medication. So you kind of have to give a little trust to them and try to build their
empower them to take that ownership. That's great.
Yes.
And I'm sure now that guy who did it on himself, he's ready to go forever now. He's still got the confidence. So
yeah, the ER was so proud of him when he got there, and they took him in the ambulance, and he said, "I did it," and they could not believe it. So I was very impressed. So it can be done.
It can be done. It can be done. Wonderful.
And I think to build. Oh, sorry. Go ahead.
Go, please.
I was just gonna say, to build on what Laura was saying, what you were saying about, instilling independence and trying to, make the teenagers become, independent and self-sufficient, right? Is the goal. Some things I would consider just to think about, right? When people are traveling, or even just teenagers in general, right? Like Laura said, okay, they may take risky behaviors, or they may be exposed to other things like alcohol or drugs or smoking, various substances that may interfere with their ability, right, to recognize or not only, recognize allergic reaction, but then also in terms of foods that they're eating as well too. It might, increase their risk taking from even the food or what they would want to eat standpoint. So sometimes a medical alert bracelet, especially depending if it's travel related, and they are going to be traveling, maybe for example, on a teen trip or something along those lines with other teenagers, like a group teen trip. Sometimes, considering a medical alert bracelet may not be a bad idea. And then also, like I was mentioning before too, making sure that someone else within the group, even if you're, it's at home, they're after school, they're hanging out, making sure that someone else, a close friend, a close school member, someone else understands and is aware of their food allergy is extremely important. Because if something happens and if they become, if they're in an accident, if they're in a car accident, whatever it may be, someone else needs to be able to recognize or to be able to communicate with, EMS or whoever it may be, that there is something that needs extra attention for that child, especially with like that teenage population where they're going to be independent.
That's great. Yeah. Thank you for adding that. Okay. We talked a little bit about, say our parents are traveling with us. They want to take the, allergic children to an excursion. We talked about some things to suggest there to protect our children, but how can we instruct our family, friends, anyone really that's caring for our children during the holidays to handle a situation, if a child does experience anaphylaxis and or an extreme reaction, like how can we equip them in that?
So, like just as in the school setting,
Mm-hmm.
you're going to have that same conversation with anyone who was coming in contact or caring for your children.
Yeah.
So you have to have the conversation about what foods they need to avoid.
Mm-hmm.
How do we prevent from eating the foods that are going to create the allergic reaction? We need to teach them what signs and symptoms do we see with a reaction? How, what are the possibilities of reaction? And then obviously, most importantly, is how to use an EpiPen, and not going anywhere without having your appropriate emergency medication. So once again, there was YouTube, there's the FAIR website. There are tons of videos about how to administer an EpiPen. And that's anyone old who's taking care of your child, school, your parents, friends, like Jennifer said, other, companions on a trip that are their friends. There should be someone that always, other than the patient, know how to use an EpiPen.
That's right. That's great. And just the baseline of 101 communication. I realized I was babysitting my nephew once, just at a soccer game. He could come along with us to watch the cousins play. And I had no idea he was very allergic to ants, not a food related allergy, and he got bit all over, just had him in his shirt and ripped his shirt off. And thankfully there was a doctor at the soccer game who ran over, and I said, he's telling me he's allergic to ants. I had no idea, and later, of course, his mom was like, I should have told you, I should have given you the EpiPen, all the things. And thankfully he was fine. But how important it is to just equip other people who just may not know. So I appreciate you saying that and adding that. And I feel like we've done such a good job, all of you tonight, of covering how can we keep, group activities safe, trips safe when our child is away from home. But Laura, I guess I would ask, is there anything that you would add, kind of just to tack on to that?
Yeah, there are some items, being my history of being in the school district, before I came to work with Dr. Kleiner and Jennifer, people don't realize that there's not only, foods that have people can be allergic to, but there are also some food sources in non-edible items that I think teachers and school staff and parents should also be made aware of. For example, finger paints. Some of them may contain milk or egg whites.
Wow,
Shaving cream may contain milk.
Interesting.
Play-Doh has wheat in it. Bean bags, which are filled with either beans, nuts, or seeds. Bird feed. I know a lot of this time of the year, people are making little bird butter. I remember in school, the children used to make the little seeds with butter and make little bells and whatnot, but nuts and seeds. So if a student had an allergy to that could pose a problem, in the classroom. And then obviously, in middle school, they have cooking class or science experiments. So it's really important that parents communicate to the teachers at the start of the school year. What is the curriculum? What is the plan? And to stress that my child has this food allergy. There are some schools. Schools vary from state to state, and from city to city. So schools have in place, they can have either forms that the school provides to the parent, where it's an individualized emergency care plan for your child,
That's good.
Or there could be standardized forms. For example, FAIR has a form that we often
Right.
use for school. So it's communicating to the administrators and the school staff when your child is newly diagnosed or at the start of the school year, getting an individualized care plan, communicating, creating an emergency care plan, and then setting that up so that you have any variable that can happen in school. With you not being there, their number one advocate, at least there are people that can help. So
That's
those are
great.
just some tidbits.
Thank you. No, that's great. And I'm so glad you talked about like non-edible items. The first thing I thought of was Play-Doh because I have
Yeah.
Play-Doh eating children. And I think they can't be the only ones. So it'd be terrible if you had an allergy. But thank you for speaking to that. And I'm watching our time here. Maybe just a couple more minutes. I want to respect your time, but just maybe a couple more questions. Dr. Kleiner, I'd love to kind of wrap it up here with you. But you mentioned a couple of those apps, and so did Jennifer. But what are some of the tools or apps that we can use to help find, a safe restaurant while traveling or even just in Miami?
So I think the Allergy Eats is very helpful for finding safe restaurants and for allergies. Spoken, SPOKIN, is one that helps you look up restaurants, recipes, and food brands. And then there's some other apps when you travel. SOSE, SOOSEE, is an app that reads labels, with ingredient labels and kind of highlights the allergens. That's come helpful.
Cool.
Yeah, as long as Shop Well, like Dr. Klein was mentioning, and Sifter Shop are other two great ones. When we're looking at labels, they scan the barcode on the label to help with, especially with like hidden allergens or just to identify allergens. Those are other two good ones to keep in mind.
Awesome. Awesome. I'm like, why didn't I think of these apps? Genius. And there's an app for everything. And there really is. Okay, Dr. Kleiner, talk to us about, we've been talking about food allergies, but 'tis the season. And do you just have any travel tips for patients with asthma, maybe going to a cold climate? Because it's a real reality for a lot of people.
So oftentimes kids with food allergies tend to have asthma. So cold weather, which obviously we don't see in South Florida that much, can be a significant trigger for kids that wheeze. So it's important to talk to your pediatrician, pulmonologist, or allergist before you're traveling. If someone's skiing or they're just going up north, if the child's on a preventive medicine, you want to start that before you leave a few days. And then also from personal experience, I know using a scarf when cold air, if you're breathing in either through your nose or your mouth, a scarf or one of those mugger masks that cover your nose and mouth. Those tend to be helpful, warming up the air as you're breathing in, particularly if you're going skiing at a high altitude. And then just knowing, same thing, being prepared to find the nearest emergency room and having medications with you. Just like you can take your EpiPen, skiing with you. It can, if it gets frozen, it'll still work. Once it thaws, if you have to inject it. And the same thing with your inhalers. You can take them in your ski parka or if you're traveling, just so that you have them with you. But the main thing is just, to start the preventive medicines before you leave, have your rescue medicine, and then scarves or warming the air before you breathe in is quite helpful.
That's good. I chuckled when you said mugger mask because it took me a second. And then I go, wait, is that the official name for that? But now I know what you're talking about. And that does make sense to have a scarf or something to warm that air that's coming in. So this was so much fun. Thank you so much, Laura and Jennifer and Dr. Kleiner, for your time tonight and your expertise. Audience, I hope you enjoyed it and gleaned as much wisdom as I did. As a reminder, this is being recorded, so we will have it ready on the site here in about a week so you can share it with a friend or go back and refer it. This is a great opportunity to screenshot this slide. These are additional resources for more study on your own. But that FAIR website we mentioned a lot of times will be a great resource for you there. I want to go ahead and make a plug for our next episode next month. So we're always the third Thursday of the month. It will be Thursday, December 21st, and it's actually going to be in Espanol. So I will spare you my Spanish. So I will not be joining you, but it is going to be nutrition for kids. So lunch is served at school. We're going to break down some of the nutrition myths and provide with snacking tips, equip parents with information that they need to not feel overwhelmed in the school lunch department. It can be overwhelming. So there are nutritious ways to make it work. So join us Thursday, December 21st for the next episode. And again, that will be in Spanish. So a great one you can forward on to friends as well. Again, parentalguidance.org. You can hear all of the archives. You can download tips and resources. You can also sign up for any of the future upcoming episodes there. So thank you again to all of our attendees for joining us tonight and listening in and learning alongside of us. And thank you, a huge, huge thank you to our experts, Dr. Kleiner, Laura, Jennifer. Thank you for being with us tonight. We're so grateful. And as always,